Hello, and welcome back to another episode of the Medicare Team podcast. My name is Thomas Fulmer, and I'm joined here by my coworker and fellow veteran, Jack Oram. And today we're going to just be diving into pretty much how Medicare and your VA, your TRICARE benefits work together and how you can maximize your benefits with both of those insurances. So, to start off, I just want to introduce myself and give a little bit of background about me and my military service, and then I'll pass it over to Jack. My name is Thomas Fulmer. I joined the U.S. Army back in 2017, and I joined as a 19 Delta, which is a cavalry scout. So, went to basic over in Fort Benning, which is in Georgia. Had a really fun time there. I'm sure fellow veterans even you can, you remember basic training. So, so that was good. Then I got stationed over in Washington State, Fort Lewis, Lewis McChord. So went over there, did my thing. And, when I got out, I wasn't really sure exactly how to, manage my VA, manage my benefits that I had from the military. There wasn't really a book that just had everything, all the info right there for me. So, even just the VA itself can be confusing, and then adding in Medicare when you turn 65, that's a whole nother ballgame. So today we're going to be kind of deep diving into how to maximize your benefits and how we can help you guys out. And I'll pass it over to Jack Oram here, and he'll give a little bit of background about himself.
Hello, my name is Jack Oram, and I'm also a former military member and veteran. I served in the Navy Marine Corps. I was a corpsman. I joined 2 days after 9/11. I'll never forget it, just like many of you folks won't. Uh, Took off and went to Great Lakes, went to boot camp, just like you said. And after that, I went on a wild odyssey where I did 3 tours. I did 2 in Iraq and 1 in Afghanistan. And on top of it, I was aboard about 4 ships. I saw 7 continents in 50 different countries. It was a great experience. Loved every minute of it. Wish I could have stayed in. It didn't work out that way, and that's perfectly all right. I use the VA for just about everything. It services all of my needs. I'm 100% service connected, like many of you are. Um, I do groups. I do just about all of my doctors and meds come through the VA. So, like TJ here, it's at first it was very intimidating and confusing, and like how to use the VA. But after, a good 6 months or so, you learn how to use it. And it's the same with Medicare. And when it comes to that, that's exactly what it is that we do here. We help you kind of navigate the waters between how you use the VA and how you use Medicare. And that's exactly what we're here for. And I look forward to being able to help many, many, many of you with this endeavor. And I'm going to leave it back to you with that there, TJ.
Of
Go ahead.
course. Yeah. Thank you. Well, thank you for sharing that. I do appreciate it. Thank you for your service.
You too.
Yeah. Thank you. I appreciate it. We can get right into the meat of it here. So, how does your VA coverage and your Medicare coverage work together? Basically, there are, 2 routes people go, and we've talked about this, on many podcasts, already know with the supplement plans and the Advantage plans. When it comes to veterans who get all of their drugs and they see all of their doctors through the VA, the main benefit that you guys are going to be looking at is the give back benefit. And I'll kind of let Jack here go more in depth about how that works and how to maximize those benefits.
Okay, great. Thanks for that. So the way it really goes is that right now, you guys at your Medicare age are holding Part A and Part B. However, you're paying a premium of $202.90 at the time of this recording. And that's a premium that we do not necessarily have to be paying because of the fact that we use the VA for our doctors and our meds. And since that's the case, we are the ideal candidate for a Part B give back. And the reasons for it being is that we do not suffer from any sort of penalty for not having drug coverage. Our drug coverage through the VA is just as creditable as Medicare's. So there's no penalty to suffer that way. And there's also no interference when it comes to how we use the VA. So if you're just going straight line by yourself to an outside doctor straight away on your own, not without a referral through like community care, then that's when your Advantage plan would kick in. Other than that, if it's all straight through referrals, from your primary care doctor, then everything just goes same, and
Yep.
just as well as it would be with your VA coverage. So this doesn't disqualify you. This doesn't usurp it and take over for it. You don't have to worry about any of things like that. That's just kind of important to know and get out to the community.
Yeah.
The other important part is that if you happen to be 70% or above service connected, if you happen to go to an outside doctor and or use an ambulance or an emergency room, urgent care, anything like that, any of those copays that would be listed, or you submit a form as to like what the bill would be, and the VA will take care of that payment for you.
Yep.
So that's one big provision that you want to make sure that we get out to the community.
For
Okay.
sure. Yeah.
Yep.
And just to touch a little bit more on that. So, when we say the give back benefit, we are referring to a benefit related through Medicare Advantage plans. And like Jack was saying, the reason that Advantage plans with givebacks are so beneficial to veterans is because, one, like he said, it pays a portion of your Part B premium, which is the $202.90 this year in 2026. And again, like he said, to dodge a penalty, to not have to have a penalty, a Part D penalty for your drugs, you would have to have creditable drug coverage through somewhere else. And through the VA, that is considered creditable drug coverage. So you won't face any Part D penalties there at all. So, and another big reason that, veterans can benefit so much from this is because, like you said, they get all of their benefits through the VA as far as medical coverage. So if you're not really using the other benefits of an Advantage plan through Medicare, why not just have that money get deposited back into your Social Security and help you pay for that Part B premium, which you're not even using for Medicare? So,
Great,
yeah,
correct. And on top of it too, there's actually like gaps that are in both of our coverages, whether it be through the VA or even through like the Advantage plan itself, where what you could do is actually, consider using a little bit of like that give back and use it for an ancillary product such as like a cancer, heart, stroke
yeah,
policy, or in some cases if you're below 70% service connected, for what's known as a hospital indemnity plan. And I'll let you touch on like what those would be, because those are actually like important, things to properly protect yourself.
absolutely.
So this way like you're protecting not only yourself, you the veteran, but you're prepared to protect your family as well.
Of course.
Yep. And
Yeah.
so I'll let you touch on what those two are, okay?
Yeah, of course. So basically, I'll start with the cancer, heart attack, and stroke policies. So the way that they work is you would pay a monthly premium, and that premium could be, it's very flexible. We could play with it to fit your budget. And what that does is if you were to have a heart attack, or you were to have a stroke, God forbid, or you were to get some sort of internal cancer, you would just have a 100% tax-free lump sum payout to you that you can use for whatever you like. That is how they work. It's very cut and dry. If you get cancer, you have a heart attack, you have a stroke, any of those, while you're paying that premium and the policy is in effect, you will get paid out whatever we set the payout to. Now, when it comes to the hospital indemnity plans, the way that they work is typically with Advantage plans, we see, co-pays per day that you're in the hospital, usually up to around 5 to 7 days that you're in there. So let's just say, for example, your hospital copay is $350 per day for days 1 through 6. We can set the payout amount for the hospital indemnity plan to match up exactly to how much you would have to pay, even more actually, to pay you out while you're in the hospital. So you pay up front, and then you send your bill to whatever company that you have the hospital indemnity plan through. They verify that everything is, good and okay, and then they just pay you lump sum.
That's VA included as well.
Absolutely. Yeah, this is for anybody. I personally, me and I know a couple other people in the office here actually, just the other day I signed myself up for a cancer, heart attack and stroke policy. And God forbid I get one of those things, I'll be paid out $75,000.
Yeah, why wouldn't you?
Why would you not do
Why
that?
wouldn't you?
Exactly. And for people that are aging into Medicare, one thing to consider is your age right now. Because you're so young and you're not, 80, 90 years old, it's going to be a little bit more expensive for them. It's still possible and you can still benefit from it. But if you get the coverage sooner while you're younger, it is going to be much, much cheaper and you can lock your rate in as you age, in your life. So, take advantage of it while you're young. Get into it if that's something that you're interested in. And, obviously I have a lot of conviction behind it I have one for myself.
Yeah, you bought one.
Of
How
course.
much more conviction do you need?
Exactly right.
Really, it's just the truth. How
Yeah.
much more conviction do you need? So this way you're just properly protecting yourself because we
Absolutely.
cannot prepare for like what's going to happen in our future.
Yeah.
And as I can just chime in and say here, well, that's for what it is that us military members were taught to be. There's
Absolutely.
nothing but prepared.
Yeah.
And that's just exactly what it is. Just to be absolutely prepared for whatever may come our way.
Yeah.
And I mean, I hope that you hear the conviction in TJ's voice, like in how it is that he's saying it, and just as well as mine, that like it's just something that we truly would love nothing more than to be able to, be honored actually to help you with.
Yeah.
Well, go ahead. I'll leave it with you. Go
Of
ahead.
course.
There's
Yeah.
something
Thank you
else
for
you
that.
want
I
to touch
appreciate
on.
that.
Yeah, for
Thank
sure.
you. So now I kind of wanted to transition over to, because TRICARE is, a little different than the VA coverage. So, and I'm going to let you, I know you're a lot more familiar with TRICARE than I am. I'll kind of just give a brief overview and then I'll pass it over to you. But when it comes to TRICARE coverage and Medicare, it works in a different way. You can absolutely still be helped out with an Advantage plan with money back toward your Social Security. I'm not saying that you cannot do that. The only thing is there is an extra step involved that you will have to do yourself as the beneficiary, to make sure that you're, getting the benefits that you want and still covered through TRICARE. So if you're on an Advantage plan and you have TRICARE, the only difference well, it would change the primary payer. The primary payer would become the Medicare Advantage plan. The secondary payer would become TRICARE. So a lot of doctors, especially ones that haven't been doing it for very long, either they're lazy or they just don't know what to do and who to bill. They will bill the Medicare Advantage plan, which then bills you. So a lot of people on TRICARE are not used to receiving bills in the mail because everything's covered through TRICARE. So sometimes the people that are on Advantage plans get a bill, they freak out, they think that they lost their TRICARE. This is not the case. The doctor billed the wrong person, and the only thing that you have to do in that situation is you have to submit that bill, and I think there's a timeline for
72 hours.
72 hours?
That's correct. 72 hours
Okay.
upon receiving the bill. It's 72 hours and you submit it to TRICARE.
Okay.
And you can do that via mail. You can do that online. You can do it via phone call as
In
long
person,
as
yeah.
in person. If you're possible to do that, you can do so. And you have to do so within that 72-hour window.
Yeah.
That is the timeline. But if you're you need to do that legwork. So this way you can keep it where TRICARE will just become your primary payer again.
Yeah.
It is a somewhat complicated system, but it's just a slight little bit of legwork that you, the TRICARE recipient, must go through. So this way you're just maintaining what your TRICARE coverage is. So this way it properly dispels the myth that you're not eligible for a Part B give back. You just have to have the understanding of what to do and how to do it.
Yeah, absolutely. That was a great way to put it. So yes, people on TRICARE, the overarching statement of there was people on TRICARE can absolutely still take advantage of the Medicare Advantage plans.
And a cancer, heart, stroke policy as well.
Of course. Yeah,
I
no,
mean,
that's
just for a carte blanche for everybody. But
yeah, I would say anybody that's, eligible and would pass the underwriting should have one of those. Obviously we talked about the stats a little bit a couple podcasts ago. I forget who it was with, but 1 in 2 men actually over the age of 50 do get cancer, and I think it's 1 in 3 women. So
it means I'm getting close.
Yeah, pushing it a little bit. Hopefully not, but Yeah, so those, I mean, when you look at the stats, it is quite scary, but the best thing you can do for yourself, like we're saying, is be prepared. Let one of us help you. We'll guide you through it, explain exactly how it works to protect yourself and protect your wallet. So yeah, and kind of we could transition a little bit into, I wanted to touch on some frequently asked questions about Medicare. Jack, do you have any offhand that you can
Oh,
think of?
yeah, for sure. I have a bunch of questions that
There
are
you go.
frequently asked to me, which is perfectly fine. That's exactly what we do here.
Hmm.
Please, if you do have, like have the time and you do give us a phone call, ask questions
Yeah.
because we are going to ask you questions just the same to give you a proper assessment. That way, we can give you a recommendation as to what to do and how to do it. So, this way, you're just set forth. You can then sit back and relax and just know that you're covered.
Yeah.
So, I mean, one of the biggest questions that I have come my way is like I had touched on before previously, does this disrupt my VA coverage? And it does not. To make that abundantly clear, no, it does not interfere with your VA coverage. The Medicare Advantage plan does not, let me reiterate that, does not interfere at all with your VA coverage. It does not interfere with your medications. You're simply allowed to, if you need to get a medication on the outside, whether it be, if you have a cold, maybe get an infection, something like that, and you need to go see a primary care doctor quickly on the outside because sometimes it's tough to see
Of
your
course.
primary care doctor inside the VA.
Yeah.
So you keep a doctor on the outside. So this way you could go see them quickly. Boom, boom, get your medicine. Perfectly fine to do.
Yep.
And it does not disrupt your coverage.
Yeah, and then that would be, when this is something I wanted to touch on. Thank you for bringing that up.
Yep, for sure.
Um, while you have this Advantage plan, like Jack said, your VA coverage isn't affected. You still get everything that you were with the VA, for as long as you stay with that. But when you do go on the outside, you will be covered under the Medicare Advantage plan's copay structure. So, and most of these plans, if you guys are just seeing, go ahead.
Outside of community care. If you use community care, if you were referred from your VA doctor to go to the outside, then the copays do not apply.
Right.
This is only if you go on your own accord to go see a doctor
Right.
solely and only on your own accord. So this way we have a clear distinction between the two.
Absolutely. Yeah.
Go
Yeah. No,
ahead.
thank you for pointing that
Yeah,
out.
for sure.
So yes, obviously, I mean, not obviously, actually, if you get sent from the VA to go to the outside, like Jack said, you're not gonna, the VA will take care of all of that. If you go with no, recommendation from the VA or you weren't sent from there or anything, that's when you'll be covered under the Advantage plan's copays.
Hmm.
And, typically for the small stuff like specialist and primary doctor visits, those aren't, very expensive. But a lot of these plans, like we're talking about the givebacks, they don't include drug coverage. So, for the people that do get drugs through the VA and also on the outside, because that's a real
Hmm.
possibility. We
Of
talk to
course.
people every day that,
Hmm.
have that. For them, there are still plans that include drug coverage that we can get you helped out with that also include a give back. So,
Yep.
um,
Yep.
there is that.
Yep. There are two different options to use. That's definitely correct.
Yeah.
And that's why it is that we do a needs assessment, a thorough needs assessment,
Yeah.
specialized to you, the veteran. So, like, just want to
Yeah.
make sure that that's poignantly clear that
Of
we
course. Yeah.
definitely ask up front, like, do you get all of your doctors or do you see all of your doctors and get all of your medications at the VA or do you use it for the outside for whatever reason may be?
Yeah.
And then if that's the case, then we're certainly specialized to go ahead and, make sure that we get something that's tailored right to your needs.
Yeah. And then another thing I wanted to touch on with the dental and the vision and the hearing side of things, and correct me if I'm wrong here, but only people with 100%, like yourself, coverage through the VA are offered dental. Is that correct?
Yes, that is
Okay.
correct. It is
Gotcha.
it is 100% service connected
Yeah.
unless there are certain provisions,
Gotcha.
if it had to do with
But
that
generally
certain
speaking, it's
in
only if you're
in
100%. Okay.
generals.
So if you do not have a 100% rating through the VA service connected, like Jack, Medicare Advantage plans offer limited dental, vision, and hearing coverage as well
Yep.
to cover those gaps, so you don't have to get a separate, shell out some more money every month for a dental, vision, or hearing policy. We do offer those as well, but speaking directly to veterans, it might make more sense for them just to stay on, the Advantage plan dental coverage.
Yep.
So, yeah.
That's definitely right there.
Mhm.
Yep. And then another frequently asked question that I get given to me is about like a lot of the times, like when we're doing a needs analysis, would be, why do I have to give you my red, white, and blue card?
Yeah.
It's a very simple answer. The reason why it is that we need your red, white, and blue card is to simply verify you are who you say you are.
Mhm.
And after we've done that, it's just a verification of your basic information, like your name, your birthday, and your address. And it just helps us get a distinction that, we're verifying that we are speaking to who we are speaking to.
Yeah,
Yep.
absolutely. Yeah, that's a good point that you brought up, and we understand, right? We understand that there are slimy people out there that are doing wrong to people, especially elderly people. They take advantage of. Um, we can promise you, as far as that goes, that we are not doing anything malicious. We do not keep that information with us there, so you are completely safe. But we understand your hesitancy when it comes to that. So
Beyond understand it.
of course. Yeah, no, I wouldn't honestly, I wouldn't want to either. I mean, I don't blame them.
Right. And if you're watching this podcast, at least you can put a face to the voice that
Yeah,
is speaking to you. And, I'm sure it helps quell some people's,
definitely.
like obvious like mistrust when it comes to, certain sensitive information that gets,
For
broached
sure.
across. Rest assured, we're licensed agents and we are required by law to make sure that we, keep people's
Follow the
information
standards, yeah.
under wraps and
Mhm.
things like that. So just, want to make sure that we get through that distinction too, because it's been in my experience that there's just been some fellow veterans that I know I can certainly help that are just not, they're just not trusting of the voice that they hear on the other end.
Yeah,
So hopefully us getting this podcast out to you, our brethren, is
yeah,
to, be able to put a face to the voice and
yeah,
understand and know that we are truly here to help you because you're part of our community and we are trying to look after you.
yeah.
That's exactly what it is part of the oath of enlistment that I took
Mhm.
and being part of the largest fraternity and sorority in the world.
Right,
I mean,
exactly.
I'm here to help
All
you,
right.
like in the best way I can. I
Mhm.
don't know about you, but
Of
I mean,
course,
I
yeah,
took that
no.
upon myself. So
Yep,
I'm trying to help you the best I can.
yep,
Yep.
you got it. That's
And
an
I'll
awesome
take
way to
that
put it.
with me until I'm rested.
Yep, that's a very good way to put it. I appreciate that,
Yeah,
thank
I
you. So
mean, I know you're all about that too.
of
We've
course,
had many
always.
a chat offline about it,
Yeah,
and it's just something I know you're very passionate about.
yeah,
You know how passionate I am about it. I am
absolutely.
all about the veteran,
Yeah,
and not only am I all about the veteran, but I'm also very fair to the veteran.
of course.
Like, I'm going to give you a great needs assessment. Break things down and do my best to explain things to you on a very brass tacks level because that's how we understand things. And I'd love nothing more than to make that connection with you.
Yeah. Yep, thank you, thank you.
For sure.
And then, before we wrap it up here in a couple minutes, I kind of just want to, share a story or two about, some veterans actually that I helped out. You got one?
Well, we have a perfect one to,
Oh,
to
we
bring
do.
up.
We do. That's right.
We have one where we helped the retired Master Chief
Yep.
together
Hmm.
with a cancer heart stroke policy.
Yep.
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 So basically, the way that phone call went is this retired Master Chief gave us a call. Shout out. Hope he sees the podcast.
Yeah.
He gave me a phone call and went through his needs assessment. And going through his needs assessment, it was disclosed that he has a family history of cancer in his family. Um, After doing the examination of the fact that he was in TRICARE, that is one of the gaps that are in TRICARE's coverage.
Yeah. So
And
like the treatment is covered, obviously.
oh, for
But,
sure.
we're saying, if you look at the statistics, I think it's 54% of the, cost of having cancer isn't even the treatment, it's the non-medical costs.
I was just about to
Yeah.
hit on that
Yeah, right.
topic right there. And that's exactly what this policy covers.
Yeah.
S- God forbid if you did ascertain cancer, especially if you have a high family history of it,
Right.
the things that we do not factor in is the fact that there could be possible travel. You may have to go across the country to go seek the proper medical care that you need.
Yeah.
And now you have to travel there. You need to feed yourself and your loved one or loved ones that come with you. And then on top of it, you need to find lodging.
Yeah.
And that's kind of important to have, especially if you're not, properly planned for that state of emergency to come your way.
Of course.
So honestly, that's just one thing that we were able to help this Master Chief out with, just in case if this did fall upon
Yeah,
him. So
God
now
forbid.
he now has protected loved ones.
Yep.
I helped, basically get the needs assessment together. And at the time I wasn't appointed, which I am now, thankfully, in Virginia,
Yeah.
but I wasn't appointed at the time in
Mhm.
Virginia. So what I basically did is, well, I shared it with a fellow veteran. So this way I could connect one veteran who needed the help to another veteran. So this way he could help.
Yeah.
So this way we were just one hand washing the other one.
Yep.
Although it's still go Navy.
Yeah, you're funny. Okay, so yeah, thank you for sharing that story, Jack. I
Of
do
course.
appreciate it. I was so glad that we were able to help that guy out. God forbid, hope he doesn't ever gets it. But he is protected in the case that he does, which is all we can do. So, with that, I think we'll leave it off there. Thank you guys so much for tuning in here to the Medicare Team podcast, and we'll see you guys soon.
Absolutely. Thank you.